All right, hey guys, it's Allison.
Hello, and Ashley.
We are going to just make some educational videos for you guys in case you're a patient of ours and kind of forgot a little bit of all the stuff we say during our appointments. Just kind of go over delivery instructions, kind of to-dos and not to-dos in case a patient or family ever needs to kind of reference this. So what you use to clean your skin is very different than what you can use to clean your actual prosthesis. So we like, with the silicones and the color pigments that we use, we prefer if our patients use alcohol to clean their prosthesis on a regular basis, not soap. There's just so many different soaps out there that it's hard to know which ones have sort of bleaching qualities to the colors. So isopropyl alcohol is what I mean by alcohol, not the whiskey kind. Clean any kind of debris off with just soft bristle toothbrush and warm water. And then the isopropyl alcohol to give it a nice good degreasing. If it's a nose, you can swab the inside, kind of where that airway is. You can swab the inside with some Listerine occasionally. You don't want to soak the whole thing in Listerine, but you can definitely swab the inside there for a nice antimicrobial cleaning there. And again, soft bristle toothbrush and water can just get rid of a lot of the debris that happens on a daily basis. So for your skin, there you have some more leniency as to what you can use to clean off your skin. Really, it's what your skin tolerates. If adhesive sticks to your skin instead of to the silicone when you remove the prosthesis, we've had patients say things like makeup remover, cold cream. Of course, the alcohol in the skin is totally fine too if it doesn't over dry your skin. Some people just kind of rub and kind of peel off little pieces. That's totally fine too. Of course, you can use soap on your skin. So, you know, really we're more concerned about what you do, what products are placed onto the silicone. So how to put on some adhesive.
So on these prostheses, we grabbed a couple different kinds. This one is going to be a total auricular prosthesis, and this one is a partial. So we'll kind of show you the differences between each one and how to care for each one. And then we'll do a nasal too, because I feel like these vary a lot. These differ a lot. So we like to use Davlin. It is a waterproof adhesive. A lot of our patients really like it and haven't had any issues or sensitivities to it. But it's not impossible to develop a sensitivity. So if you are using this and you notice any redness or discomfort, tell us if you're one of our patients, or if you have another anesthesiologist, let them know. So I'm going to start by applying the adhesive and brushing it out towards the edges. These really thin edges are what helps it kind of blend in with your skin. So you want to make sure you bring it all the way to the edge. So you can see that it's shiny where the adhesive is and it's matte where there's no adhesive. So this adhesive is solvent based. So after applying it to the prosthesis, before you put it on your skin, you want to let it set for at least 3 minutes. It will stay sticky for even longer, so you can go do the rest of your morning routine or whatever you need to do while that's drying. So for the partials, you are working around some complicated anatomy. So everyone is a little bit different. On this particular one though, we're gonna wanna do adhesive around these thin edges, just like the other one. So after you paint it on this area, really the goal is to not have to put any adhesive in these nooks and crannies, because it's going to be hard to kind of work around your anatomy. If it's necessary, try to keep it to a minimum. But ideally you would just need it on this outer surface and not these more complex areas. So we're gonna let that set for 3 minutes. Okay, so our adhesive should be set up. For this type of adhesive, it is very, very sticky and will stick to the first thing it makes contact with. So especially for our patients that are newer to the world of prostheses and adding this to their daily routine, it takes a little bit of practice to get that muscle memory down. So we like to use a trick with rubbing alcohol. We will soak just a little 2x2 gauze in rubbing alcohol and dab it around the edge. You don't want to wipe because it can wipe off that adhesive that you just so carefully applied. So you can see I can kind of move it around a little bit on my hand, but if I hold that in place and let that alcohol evaporate, it's not going anywhere. So to take this off, you'll want to soak a Q-tip in rubbing alcohol. And it's different for every person, just depending on your anatomy, but there's usually one spot that's a little easier to get this started in. You'll just want to roll that Q-tip with rubbing alcohol on it under the prosthesis and it comes off. So on your skin, you may have a little bit of residual glue. As Allison said, you can get that off with whatever you'd like. But on this prosthesis, you can see this is still very sticky. So you're gonna wanna put a finger behind those thin edges to support it and kind of rub towards the edge, and that glue should start to ball up and come off. And you know that all the glue is removed when it is no longer sticky to the touch. And again, you can wipe this down with alcohol or whatever you would like to use that we've advised to clean this. Usually alcohol or warm water and a soft bristle toothbrush. So nasal prostheses are a little bit different. You're gonna put most of your adhesive around this thin edge up at the top. There's a lot of movement down here where your upper lip connects with the bottom of your nose. So it's ideal to not have to put any adhesive down here because you don't want it to pull on the skin. So for a nasal, we're gonna start again the same way as the ear and applying that adhesive to only the parts that are gonna make contact with the skin. All of this inner part is not going to be touching skin. That's open airway. So we don't want any adhesive there. And again, we're gonna let that set for a very minimum of 3 minutes. And so for the nasal, after that is set up for at least 3 minutes, you'll do the same alcohol trick and dab this around the edge, and that you'll place on the skin. You'll need to probably hold it for a few seconds to give that alcohol a chance to evaporate. And the same as with the ears, you're going to want to use a cotton swab and alcohol to loosen those edges. You are going to want to be careful around the inner corners of the eyes if that margin of your prosthesis is close to your eyes, because you do not want to get alcohol in your eye. Then on this surface, this adhesive that you put on here before, it's going to be the same as the ear. You're going to put a finger behind those thin edges to support it as you roll this glue off. It will usually roll into a ball. So you'll just continue working your way around the edge, getting that adhesive off until it is not sticky to the touch.
Okay, so cleaning your skin around abutments is a little bit different because you have these kinds of posts showing, right? So ideally your surgeon gave you some cleaning instructions that would certainly still apply, but if they did not, or it's been a long time, you can follow these instructions. So we like a Q-tip and kind of warm water, or if you feel like there was any kind of buildup here, you could use some diluted peroxide to kind of swab around these abutments. Another thing you can do is keep a soft bristled toothbrush in the shower and just kind of use that when that skin is nice and moist and wet. You can use that soft bristled toothbrush very gently to go around these in the shower.
So when you're cleaning around these abutments with your Q-tip, you're gonna want to go around clockwise, because these pieces are actually little screws that are threaded into the implant that is inside the skull or bone, wherever these are anchored to. So if you always clean in a clockwise motion, you're not going to be accidentally loosening those screws if you were to do it in a counterclockwise. So righty-tighty.
So sometimes we're working around some complicated anatomy. So this is actually a model of someone with microtia, and the prosthesis actually fits kind of down and around that, that tissue that was left there. And so in circumstances like this, positioning with adhesive, this is an adhesive retained prosthesis, just give yourself some extra time, some grace, some patience to help you get that positioned. You know, usually in our experience, the first week someone has a prosthesis that's a little more complicated like this, you know, there's a little bit of a learning curve there, and just be patient. Give yourself a little extra time in the morning to get it going. Okay, well, please keep in mind, guys, that these instructions are intended for patients of our practice with our materials. And of course, not everyone's situation is the same. Everything is very customized. So please do not think that we are trying to overrule anything your provider has told you to do, or your surgeon. Very generic instructions here. But if you have any questions, comments, you can leave them below.
Leave them in the comments. We're gonna try to make more videos like this to maybe give y'all some more information and kind of, you know, leave some reminders if you haven't been in our office in a while, or if you're maybe going to a care facility or having a caretaker and you need to catch them up to speed on what you've been doing. So hope this was helpful. We'll see you in the next one. Bye.